Both aged 17, the two girls we opt to call Malaika and Angel were raped just days before sitting for their Uganda Certificate of Education examinations. Abandoned by closest family members, well-wishers directed them to Wakisa Ministries, from where Malaika has since safely given birth.
My mom was angry at me. Every day she would yell at me, she could abuse me.
The heavily pregnant Angel is yet to give birth to her twins. The duo is part of 8,000 girls over the past 20 years who have walked into this center. They entered hopeless but left with hope and a bright future. One of such girls is Nachibombo, who has since graduated and is giving back to this ministry to support other innocent girls.
A girl who was not supported before and supported by Wakisa Ministries is now supporting other girls around their communities and helping them to raise their voices and also speak up for themselves, because she wasn't taught that before.
Officials at the Wakisa Ministry say on average, 4 pregnant girls are registered weekly from the police family office and others reach the facility individually from the community. Vivian Wachisakityo, the vision bearer for the ministry, who was inspired after watching a teenager bleed to death following an abortion, says abject poverty in communities is the main reason behind most of the teenage pregnancy cases they are handling.
We have been receiving girls between the ages of 10 to 20 who have been rejected by family, who have been pushed out of their homes. And they've been brought by the police and other organizations. And we realize that once a girl gets pregnant, she becomes kind of a taboo in the home, mainly because it's a culture. Girls are not supposed to be pregnant. They should be in school. But you find that there are girls who have not been taught sexual education. And some of them who have been taught, they are poor and looking for money.
One of the biggest causes of this crisis is, of course, poverty. Most of these girls come from communities that are not doing so well, and out of their need to live better lives, they are tempted to, look for avenues of how to survive. And so they fall prey of men.
Wakisa Ministries petitioned Parliament for financial support to the facility, but a team from Parliament that visited them has never responded positively.
There was a team of parliamentarians who came here in a very huge coach, men and women, and they promised us heaven. But up to now, it's been 3 years, I haven't seen anything, I must say. I'm still waiting. And we also tried to move and went to the Parliament ourselves and petitioned, and we were asked so many questions, and they promised to help this ministry and help the young girl, the child who gets pregnant. But we are yet to see what they have.
In the next 10 years, Wakisa is hopeful that they will have a bigger, fully-fledged maternity ward that can support more safe births for teenage mothers. Currently, heavy taxes levied on imported maternity equipment to their new maternity is straining their finances. According to the 2022 Uganda Demographic Health Survey, the teenage pregnancy rate in Uganda is at about 25% for girls between the ages of 15 and 19, meaning 1 in 4 teenagers has had a child or is pregnant. Juliet Naloga, NTV.